Well, for a closer look at vaccination efforts in India, we're joined by Dr. Aqsa Shaikh. Now, she is the head of the vaccination center at the Jamia Hindard Institute of Medical Sciences and Research. Dr. Shaikh, I want to thank you so much for your time. We've heard the stark numbers coming out of India. Can you describe what it's like inside your hospital these days?
Hi, greetings from India. Unfortunately, India is suffering from a severe shortage of oxygen. And the state and the city I come from, the capital of India, Delhi, right now is suffering from an acute shortage of oxygen. In my own hospital right now, we are on backup cylinders, which are also not filled. And we don't really know if the next tragedy that happens is going to be in my hospital. Yesterday, in my neighboring hospital, the Batra hospital, we lost 12 people because we couldn't supply enough oxygen. There was oxygen cut off for an hour. And one of the casualties was a doctor, someone from our own. So we don't really know, which hospital is going to be next, in which people are going to lose lives because we couldn't supply oxygen in time. We are getting only 1/3 of the oxygen that we require right now. So it's a very scary situation right now in almost all the hospitals or nursing homes in Delhi where patients are there. And even those patients who couldn't get beds and are at homes on oxygen of some kind are also facing the same situation where we don't know how many hours it will last and if they will be the next schedule.
We are hearing, of course, these numbers, 3,700 dead, 400,000 ill every day, and yet there are many that suggest those are just the official numbers and that the actual numbers of dead and cases could be much higher. Is that the sense that you have?
Absolutely. So the epidemiologists and the public health professionals and the data scientists have been working over these figures. And we all know that the actual figure, either of the deaths or of the new cases, is likely to be 2 times what it is currently being projected. We can only guess it from this thing that in Delhi, we are running out of space to bury our dead. We are running out of wood to fire our fires. So this is the situation right now on the ground. We don't have oxygen for the living, and we don't have the space for the dead people.
For your colleagues and yourself, you're dedicated to saving lives. How are you managing with the current crisis that your system is in?
Just to give you an example, yesterday a doctor in a hospital in Delhi committed suicide because of so much of depressing situation that we are in currently. We are feeling totally helpless because the oxygen is not something that a doctor can manage. It's the responsibility of the government, it's the responsibility of the administration, and they have failed us big time in this. In my own hospital, the anesthetists are saying that the situation is so scary that he is afraid he might get an heart attack, because of so much of pressure. Fortunately, the patients are not beating up the doctors or breaking down the hospitals yet, though we have had a couple of such incidents happening. But then the situation is totally helpless and it's very chaotic, very depressing. And the same is also true for the doctors who are at different times.
The other aspect of this crisis, of course, appears to be the lack of vaccines. The head of the Serum Institute leaving the country. Real questions whether there will be enough vaccines, as you know, for well over 1 billion people. How worried are you about that?
Unfortunately, India, which is one of the biggest, not one of the, rather the biggest vaccine manufacturer in India, has not been able to vaccinate even 10% of its population in the last 3.5 months that we started vaccination. And from yesterday, we were supposed to vaccinate all the 18+ population. But due to the shortage of vaccine, the program has been only symbolic, with only a few thousands getting the vaccine. The fact that the manufacturer of one of the largest facilities and vaccines in India had to run away from the country and go into a safe haven can only describe to you the pathetic situation that we are in currently, where everyone has simply washed off their hands of the responsibilities. Neither the government feels responsible, nor the vaccine manufacturers feel accountable. And all this happening in the middle of the most deadly second wave is just filling us up all, with rage and fury against the system, against the government, against the vaccine manufacturer. We're totally helpless in the situation.
Dr. Shaikh, I want to thank you for your time, and I want to wish you all the best in what is a very difficult fight. I really appreciate it.
Thank you. Thank you.
Dr. Aqsa Shaikh is the head of the Vaccination Center at Jamia Hamdard Institute of Medical Sciences and Research, and she joined us from New Delhi.